Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Uh, what I would like to say is epilepsy is a very common problem in our society, but it is not adequately treated right now. People consider, still in the interiors of India, epilepsy is still considered कि हमने माता आई गई छे, and if people don't consult a medical practitioner, they don't consider that this is a neurological illness which can be treated adequately.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, for a in a simple language, seizure is a uncontrolled activity of the brain, which is originating from the brain and which leads to loss of consciousness. So, patient becomes unconscious during the episode, and he may have abnormal jerking of the body. So sometimes it starts with like sometimes the face will start twitching. So patient will have the face will twist to one side and followed by like the shaking of the body, and then they lose control of the body. They may fall to the ground, and this is caused by abnormal electrical activity in the brain. So that is what, as in simple terms, a seizure is.
What is epilepsy?
So when a patient has recurrent episodes of seizure, so then we call them to have epilepsy. So somebody may have a single episode of seizure or the jerking of the body and the loss of consciousness, that is a seizure. But somebody who continues to have recurrent episodes of seizures is supposed to have been diagnosed with epilepsy. So the epilepsy is frequent occurrence of seizures.
What are the different types of seizures and do they affect people differently?
So different types of seizures could be, so one are called the simple seizures and the other ones are complex seizures. So in simple seizures, you would not have loss of consciousness. Patient is conscious and he knows what is happening to him. Okay. In a complex seizure, they have abnormal movement along with that impairment in the consciousness. So they don't know what is happening to them. And the seizures can also be partial seizures or generalized seizures. Partial means only a part of the body is affected. So they may have just the jerking of the arm. So just one arm is shaking like this. And generalized, the whole body is shaking. And they lose the control of the body. They may fall to the ground, get injured also during the episode. So that's the difference between a simple and complex seizure and a focal and a generalized type of seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
There is not always a known cause for epilepsy. So, epilepsy can happen because of a structural damage to the brain. So, if somebody had an accident and because of which he had a head injury, or if somebody had a tumor in his brain, somebody had a stroke. So, those are, or may have some kind of a vascular malformation in the brain. So, those are kind of the structural abnormalities in the brain which can lead to a seizure or epilepsy. Lot of times patients MRI may be normal and they may still have recurrent episodes of seizure, and that can happen. Some of these epilepsies, especially in kids, could be genetically mediated. So they may have abnormalities in the ion channels that control the movement of electrolytes in our brain, and because of which they can develop recurrent episodes of seizure and the epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
See, the obvious one, when somebody has the full body is shaking and they fall to the ground, their mouth, they have frothing from the mouth, so they and their eyes roll up. So that I think most of the people are able to recognize them as that somebody is having a seizure or epilepsy. Sometimes the epileptic episodes can be very subtle. So they could just, somebody might be working and then suddenly just stops working for like few seconds, and then they don't know what happened, and then they start going back to their work again. So those could be, they could be as simple as that, or it's such benign episodes also, especially in kids. Usually the kids don't know what is happening. Sometimes teachers or the friends comment that he is not paying attention in the class and he's spacing out a lot in the class. So those could be subtle signs of epilepsy. Sometimes people may have just one or two like drop attacks. So they sometimes they will be working and they may just drop their pen from their hand, or sometimes they're just walking, they suddenly just fall down to the ground. So they could be more like drop attacks kind of episodes also. The other thing that help us understand is sometimes if these loss of episodes of loss of consciousness are associated with tongue bite. So if they bit their tongue during the episode, or they passed the urine or the stool during the episode, that helps us that this likelihood of these episodes being seizure increases.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
I think the most common reason, especially in our society, because it is considered that these episodes are happening as a result of some like mata or some devi getting into your body, and that's why people think these are called mirgi in common language, and people tend to hide about it. They don't discuss it within the family, or they don't discuss with their medical practitioner about somebody having these episodes. So, and especially in females, it is a big problem, because if somebody has epilepsy, to find a groom for that girl is a big difficulty in our country, and that's why people don't consult or don't talk about these disorder. I think those are the barriers towards the treatment for this condition.
How does this stigma affect people with epilepsy?
It is mentally as well as it's emotionally draining for the people, because see, they don't get treatment appropriately because of this, and they usually try the local like home remedies, like somebody will have like having them smell onion, or sometimes shoes, or they will take them to the local like those jhadfus wala guy and get them treated for those things, and they don't get adequate medical attention. They don't realize that there are a lot of good treatments available for the epilepsy, and if patients take these medications on a regular basis, then their seizures or these episodes can be controlled for majority of the people, and they can have a very lead a very normal life with the treatment.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
There are some things that can trigger epilepsy. Sometimes there may not be a specific trigger that can be identified in certain patients, but some patients may have their episodes be triggered by like bright lights or like the flashing lights. Sleep deprivation is a major trigger for epilepsy. So when the patients have not been sleeping well and they have been sleep deprived, so that can trigger their episode. So we always advise them to sleep, have a restful sleep as much as possible. And for certain people, there could be unique triggers. So sometimes, like there are people who maybe their episodes are triggered by laughing or by doing simple mathematic calculations. So those are unique cases where there are specific triggers that triggers their episode of seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Most of the time, see, managing a regular routine, so you sleep well and have take your medication regularly on the same time. But the other things that you have to adjust, somebody has to adjust with epilepsy, is driving. So people who get epilepsy should not be driving, because if they have an episode while they are driving, they could injure their it could be dangerous for them as well as for the public. So those are the, they should, we also advise them to avoid going to swimming pool, or to a hilly place where if they had an episode they could fall. So they should always be under observation when they go to certain places like that. And or their epilepsy should be very well controlled, so they at least should not have had a seizure for 6 months or so. So we know that they are well controlled on the medication. But otherwise they should be careful about working in the kitchen, for ladies working in the kitchen, if their epilepsy is not well controlled. So if they could be working on the stove and have a seizure and fall like in front of the gas. So those things have to be taken in account.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Major thing, if you or anybody in your family or a friend has is having a seizure, the best thing to do is to have them lie down in a safe place. Try not to put anything in their mouth, especially your hand, because they may bite your finger. If the seizure has already started and their teeth are already tight, don't try to open the teeth by putting a spoon or anything like that. You will actually cause more injury by doing that. If you know that it is going to start, then you can put a piece of cloth like a towel or something in their mouth so they don't bite their tongue. uh, you should turn their head to one side so that any of the secretions like the frothing of the secretions, they just fall off to one side. Make sure they're breathing properly, because sometimes they can choke on their own secretions. So you can turn them to the side so that all the secretions, they fall off to one side and they don't choke their airway. And you, most of the seizures will stop on their own in 1 or 2 minutes. But if the seizure is prolonged, it continues to happen for more than 3 or 4 minutes, then you should call the emergency medical services and take them to the hospital. There are also emergency rescue medications like a spray that you can keep at home. You can talk to your doctor about that, and that can be used in the case of emergency.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Now, just you can be have a very normal life if you have epilepsy. Just need to be treated adequately, and just little bit modification to your lifestyle schedule will take you a long way.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.